One of the Real Wellness sponsors is Sina Clinic. Sina offers low-cost or free full health care for a variety of common health problems to anyone with or without health insurance. Affordable health care, quality health care. That is the cornerstone of Sina clinics.
So Southwest Houston has a lot of people living in densely populated areas, something like 65,000 people, and majority of them have no health insurance. So uninsured population clustered too much in this area, and that's what the whole idea is, to open the clinic.
As you see, the name of this clinic is Ibn Sina, and in the Western world it's called Ibn Sina. This is the gentleman who was a humanitarian, who was a physician, who was a poet, who was a king or premier of his time, and he was the person who wrote the book called The Canon of Medicine, which described the treatment of the tuberculosis for the first time in the history. And this book was taught in Europe during and after medieval times. And one of the things that inspired us to keep this clinic in his name, that was to serve the humanity regardless of color, creed, race, gender, or income. After all, we all are human beings, and that is the most important thing to be considered.
Office visits are $25, but Sina turns no one away. No one.
My first impression was they might gonna charge too much because it's so clean and beautiful and everything is so perfect in here. Like, you feel so relaxed, and they talk to you very immediately what's the problem and what's the reason.
This mother will never forget her first visit to Sina Clinic. Her autistic young daughter had a rash and was crying uncontrollably, which led to Mom becoming very upset.
I came in here, I was crying so hard that I couldn't even talk, and immediately I didn't need to even stay in line or wait or anything. They just immediately took care of her. They prescribed me medication and everything. They recommend me their Healthy Kids program, which I really love, and that's how it begins. Like, it was a very horrible day for me, but it was a great day that I found Ibn Sina.
And now Sina is their family medical home.
Totally life-changing experience for me, because at the point when I came in here, I was very depressed because we cannot afford the doctor's fees every other week, because with kids you have to go to doctor. You cannot say when you need to go to the doctor. So we were like so upset all the time. We were like so in stress that we tried our best not to let them fall, not to get them sick. So now it's like I'm a little relaxed. Like, when she falls and if she have fever, I don't need to worry about it. Like, I'm fine, I can bring them here and they'll check her.
The clinic treats a variety of problems, but most often the complaints center around the diseases common among the local population: diabetes, heart disease, high blood pressure, and some cancers.
The problems that I run into is more of the fact that I need to spend more time educating them, teaching them the importance and correlation that mouth is part of the human being, of the body, and how they tie in together, how the diseases are all interrelated. So that is what we're trying to focus on, in addition to actually taking care of them.
Volunteer physicians and other health professionals also provide dental, eye, pediatric, and gynecological care. Their goal is to try and cut down on the number of people visiting local emergency rooms for routine care.
If you look at the care provided by this clinic, is no different than any other well-established clinic in this city. So the quality of the care is utmost important. We do follow all the guidelines for the chronic conditions. We try to provide the lab testing at a very reasonable low cost, so they can have the routine testing for the chronic conditions. And the whole purpose of this clinic is to provide the routine, regular care at the nominal cost and in the best possible environment.
To encourage patients to come here rather than an ER for routine issues, Sina offers a low-cost enrollment plan for both families and individuals. Ibn Sina also partners with the state of Texas to enroll children in what's called the Title V program. That allows free medical care under certain income guidelines.
Through this program, we have identified 4 children with cardiac murmurs. We have diverted them to the hospital. Then we have a child identified with a breast lump. We have referred that to other non-profit organizations. Then we have a child with hearing aid problems. They are not able to even buy that device. So we help them, and we have, with our collaboration with other institutions, Ibn Sina have referred them to the institution, and they got that device without any cost.
Funded by a private foundation, Ibn Sina's goal is to open more clinics, not only around Houston, but around the state.
We do want to open more clinics like this, but of course that's challenging, not only financially, but to get the voluntary services. One of the reasons this clinic is successful is because of the voluntary services of many medical related person. That includes physicians, paramedical staff. So as we find more and more people interested in providing their services, we will be willing to open more clinics.